We have breaking news out of Ontario. A child has died of measles. The death is the first one linked to the infectious virus in the province in more than 10 years. Ontario Public Health reporting that the child, who was not immunized, was younger than 5. Measles is a highly contagious respiratory virus. Symptoms include fever, a red blotchy rash, red watery eyes, and a cough. Let's bring in Dr. Christopher Labos, an epidemiologist and cardiologist. Doctor, thank you as always for joining us.
Oh, my pleasure. Thank you for having me.
Stunning news to hear this, a 5-year-old or a child younger than the age of 5 dying of measles, first time in more than a decade.
Yeah, and here's the thing. Whenever we talk about vaccination or public health, people tend to sort of frame it in terms of political issues or social issues or identity issues. This is what I believe. This is what I don't believe. And they think it's a very abstract thing. And you forget that the reason we talk about this is because we don't want kids to die. This is exactly why we talk about measles vaccination and all the other public health measures that we've been talking about for the past few years now. It's about preventing death. And people have convinced themselves to some degree that measles is a theoretical risk or that it's a mild virus, that it's a routine thing that everybody has, that it's not a threat. And no, it is a threat, because when you don't have high vaccination rates, you have measles outbreaks like we've been having in this country. And the consequence of that is that eventually a young child that would otherwise be alive ends up passing away. And that should be seen as a tragedy. Any child's death should be seen as a tragedy. And we should remember that if we allow vaccination rates to continue to slip, we are going to see more measles in this country, because while we had largely eliminated it from North America, it was still very present globally, to the point where there are not a single death globally, but thousands upon thousands of deaths every year from measles across the entire planet.
Now, and this child was not immunized, and usually the vaccine is, I believe it's 6 months and 2 years for the measles?
It's actually different province to province, which is part of the issue, because it becomes very, very confusing for people. Because people in Ontario are looking over at Quebec and saying, "Hey, why are the time frames different?" So it would be good if we could harmonize it. But yeah, you fundamentally reached the point. It is a 2-dose vaccine, but even getting that first dose is going to give you a fairly good degree of protection. And of course, to make it even more confusing, we used to only give 1 dose of the measles vaccine, and it's only relatively recently that we started completing it and giving people a 2nd dose. So there's a lot of people walking around now that only received 1 dose of the measles vaccine as a child, and they are perhaps incompletely immunized. But as long as there's very limited number of measles out there, you're probably going to be okay. But if we start seeing repeated outbreaks and flare-ups of measles like this, we are going to have to start thinking about going back and getting all those people who only had a single dose and making sure that they have their 2nd.
And what is our vaccination rate at in Ontario, across the country, and what do we need it to be at?
We really need it to be at 95% to achieve herd immunity. I know people talked a lot about herd immunity during the pandemic. Most people didn't understand what that means and used the term wrong. What herd immunity means is that if you can get enough people vaccinated, that will protect the small number of unvaccinated people, like the very young children under 6 months of age who can't be vaccinated, right? The people who are immunocompromised for whatever reason and can't be vaccinated. So we have to have a very, very high rate of vaccination, because measles is so contagious. And what we've seen over the past few years is that we've been drifting down from the 90s into the 80s, at some places into the 70s. And there are certain pockets of the country where the vaccination rate is very low. You're talking like under 50%. And that is a problem, because those are the places where measles outbreaks tend to happen. We've seen that in Canada and we've seen that in the US. So it really is about informing the public. Measles has not gone away. We were able to largely eliminate it as a cause of death in Canada because we were so good up until a certain point. But if we let things slip, measles is still out there internationally. It is going to come back because of international travel and because of the movement of populations.
Now, is this a growing anti-vaxxer movement? The anti-vaxxer movement's been around for a long time. I know people 10, 15 years ago who were refusing to get their children vaccinated. Was that accentuated by the pandemic?
Yeah, to a certain degree, yes. And of course, part of it was, people missing appointments because everything was shut down. There was, as most people remember, a fair degree of chaos during the first couple of years. So that was certainly a part of it. I think there is a growing anti-vaccine sentiment, or at least a growing sense of vaccine skepticism, which is very, very disturbing because the end result of that is a child dying, as we've just seen. But it's also a problem that, if you're of a certain age, you remember what measles looked like. You remember the fact that everybody would get sick, and you would remember cases of people dying. But there's a lot of people walking around Canada right now that have no living memory of measles or of polio. These are theoretical things they've heard about, but they've never actually seen. And so to try to motivate people to start thinking about this as a very real threat to public health is a very hard sell, because you're talking to them about something they've never experienced. Right? They've never
Okay.
experienced polio. They've never seen what it means to be in an iron lung. These are things they see in movies. They don't think that it's real. And so that is the problem, is that we're trying to argue for theoretical risks and benefits because most people don't have firsthand experience with them.
Okay. Doctor, thank you as always for your insight and expertise.
My pleasure. Take care.
Dr. Christopher Labos, epidemiologist and cardiologist.